So in today's video, we'll be talking about acute rheumatic fever. So acute rheumatic fever is an inflammatory condition of the heart caused by group A beta hemolytic streptococcal infections. Okay, so now acute rheumatic fever goes on to affect many other systems in the body. Okay, it can affect the central nervous system, the skin, and the hematological system. So whichever system this bacteria gets access to, it's capable of causing many other effects in the body. Now, how does acute rheumatic fever come about? So it comes about as a result of untreated group A beta hemolyticus streptococcus infections. So a patient might come through to your hospital, and when you find out to probe further in their history, they'll tell you to say, maybe you discover to say they've had an untreated history of group A beta hemolyticus streptococcal infections. Perhaps they had tonsillitis, they had pharyngitis, or any upper respiratory tract infection. So what's really happening in this situation? How is the heart coming into play from an infection that was in the upper respiratory system to affecting the heart? So now this is exactly what is happening in acute rheumatic fever. So what is happening is that there is infection in the system. Now this infection goes as far as affecting the valves in the heart muscle. So this is what is happening, all right? So what is happening is that group A streptococcal infections have a certain protein myosin, okay? And similarly, in the heart, we've got protein myosin that is there. So instead of your immune system attacking the streptococcal myosin proteins, it also ends up attacking that protein myosin found in your heart. So at the end of the day, there's going to be tissue injury. This tissue injury will eventually cause inflammation of the heart, thus us having acute rheumatic fever. So it's like this scenario, okay? Your police in your community are informed to say, in Bank of Zambia, there are robbers that are there and they are armed, okay? And as they start off from the police with their Land Cruiser heading to Bank of Zambia, right at the gate of Bank of Zambia, they find some people who are armed and they have guns. And now instead of really arresting the people that are inside the bank, they end up arresting the people they found outside because they also have guns. So as they arrest them and shoot some, they later on are informed to say, actually, the people you're supposed to attack are those inside the bank and not those outside. So this is exactly the thing happening in acute rheumatic fever. You see, the immune system is very sure to say it's attacking the right bacteria, okay? But then it discovers to say, actually, these bacteria that have entered in the system, the structure of the proteins found in these bacteria are similar to the protein structures found in the heart. So the immune system also ends up attacking the proteins myosin found in the heart. Hence, this causes injury and inflammation. I hope you enjoyed this video. Subscribe and follow. Bye for now.
Yeah, bye.